Yes, my name is Dr. David. I hold a PhD in public health and I am a reproductive health expert. I have come up even while I'm out of town to answer one question because a number of persons, about 4 or 5, have asked the same questions on the comment section, and I've just decided to make this short video to answer you, and also to teach those who are going to be watching this video for the first time. Somebody has asked, another one asked, about 5, 6 of them. And the question is, in my other video, I was talking about targeting, having sexual intercourse, targeting pregnancy. How do you go by it? And that there are people that even their doctors give them the date following the fertile period of the woman. They follow it. They have the sexual intercourse and it still fails. They don't have the pregnancy. Yet, they do not have any medical condition that jeopardizes the chances or that jeopardize their chances of getting pregnancy. But the practice of sexual intercourse has always been a problem. And I said in the last video that when they give you such a date, and it is true that your wife or your woman is ovulating within those days at that time, when the time reaches, you both should have sexual intercourse once. Because by then you would have stayed away from sex for a few days, giving chance for the testes in a man to produce healthy sperms and store them. So when you meet on that day, very healthy sperms and in their number are ejaculated. You are just supposed to have that sexual intercourse once. It doesn't take 2 times to produce the result. And I said avoid to even get into that woman the second time the same night. And the people keep asking me why. They don't understand. This means that it is really a worrying point. My dear brothers, this is the reason. I made another statement there that when a man ejaculates into the vagina of the woman, the ejaculate takes 4 hours to 6 hours, a range of 4 to 6 hours that the ejaculate takes to move from the vagina through the cervix into the uterus. Unfortunately, some people will rest and wait for the D-Day. When the D-Day reaches, they have the sex, the man will ejaculate quality sperms, and you see him getting on that woman again the second time in less than 30 minutes, in less than 1 hour, in less than 2 hours. No, all what he ejaculated is still in the posterior fornix of the vagina. And so, when an erect penis enters there, there's a ring at the tip of the penis. You will notice that second time of intercourse, the whole place seems more watery as it's just going and bringing it out. It will bring out everything. It will bring out all the semen with sperms, my dear, and rub some on the walls of the vagina and cut them and cut their teeth and denature them and kill some. And so they end up bringing out everything without allowing the ejaculate to enter into the uterus of the woman to give chance of fertilization. And so some of them will just quickly get in, have the sex second time. They cannot even leave it the second time. While you ejaculate the second time, you come out and rest 30 minutes, 15 minutes, 1 hour, and you are erect. You enter again. Some even count the number of times they have sex in one night. Some begin to tell that, no, I give 6 more, I give 7 more. What? Only local heroes make that kind of statement. In reproductive health, there is nothing like a hero. Just target, reserve yourself, prepare yourself, let there be healthy sperms, have good erection at the right time when your woman is ovulating, have sex once, ejaculate, leave. You can even travel. There was a time I advised a man when he was living in a different town and the wife was living in another. And the man actually planned and came during the fertile period of the wife. That same day, I advised the man, you know what? This same evening, When you have sexual contact with your wife, leave. You can travel in the night. Thank God vehicles travel in the night. And the man was asking me, why, doctor? I said, no. Because if I allow you sleep by that woman, you will be tempted to want to have sex again. You want to have sex again 2, 3 times, 4 times, one night. No. You are mixing pleasure with business. And anytime you mix pleasure with business, you fail. My dear brothers and sisters, if you do not have a disease that is preventing you from getting pregnant or getting a woman pregnant, if you, the woman, you don't have any growth in your womb, you don't have any ovarian cyst, you don't have blockages, you don't have any problem, even psychological, that can block you from getting pregnant, my dear, it means that the practice of sex has not been the best. Sometimes you may be having the sex during fertile period, but you squander the chances of getting yourself pregnant. Subscribe to this channel, Dr. David Reproductive Health. Give your comments. You can ask questions. You can even talk to me on WhatsApp. My contacts 674-605469. Thank you.